Healthcare workers have been given more responsibilities when caring for their patients since the pandemic started, especially when those patients are senior citizens. Our Dan Booth tells us what some in-home care providers are doing to keep their elderly patients as safe as possible.
We cannot leave our seniors in the dark.
Home Instead is an organization designed to help care for senior citizens in their homes and in senior living facilities. Naturally, when caring for an elderly person where they live, Home Instead's healthcare providers have to take extra precautions to keep themselves and their patients safe.
We're doing temperature checks, we're making sure that caregivers have the proper PPE to wear.
It's kind of become second nature just doing these things, and I think it'll take a new adjustment when we do finally get past this virus.
Recently, it hasn't been easy for many senior citizens to communicate with their family members, and illnesses like Alzheimer's and dementia can complicate the situation even more.
Like, there are people who are sharp as a tack that are still, frustrated that they aren't able to see their loved ones on a regular basis.
With limited visitations allowed for safety reasons, caregiver Daniel Youngblood says over the past several months, he's tried to be like an extra family member to his patients.
There would be some days where we'd be the only people they'd see on a given day, or those sorts of things. So I think that's a big responsibility, and I think we take it as such. And to me, I think that is an encouraging thing, because you get to be a big part of these people's lives.
Due to the increased demand for home care providers during the pandemic, Home Instead is looking to hire about 20 new medical professionals in an effort to make sure every senior citizen battling health problems gets the care they need.
The folks we're working with are the most vulnerable population and demographic, and so obviously that puts a lot of onus on us to do our part to make sure we're keeping them safe.
It's up to us to make sure that we're still there and we're impacting their life one day at a time.
For BigCountryHomepage.com, I'm Dan Booth.
Thank you, Dan. Absher says about 10% of their care providers have received the COVID vaccine, and she's working on making sure all of them get the vaccine to limit any kind of exposure to the senior citizens they serve.